Okay, I wanted to show you kind of some intubation equipment here. So I've laid it out on the table, and I'll go through it one by one. You can see here we have a handle, which is right here, and we have a Miller blade and a Mac blade. Miller blades are straight, and you can remember that by the two L's in Miller, and Mac blades are curved, and you can remember that by the C in Mac. Now, there's different sizes of these, and it's usually physician preference based on the patient's size. And you would connect this to the handle, and it would light up. And let me show you that real quick here. So you can see that this is what it looks like. There's a light on the end, and then this would go in the patient for intubation. This also folds down like that for easy storage. You should clean those after every use. Next, you're going to see the ET tube. Notice that the ET tube has a syringe attached to it. That syringe is usually a 10 cc syringe and should be attached prior to giving it to the physician to put into the patient. This is going to go down the patient's airway, and then the cuff at the bottom, which is this balloon, is going to inflate with the 10 cc syringe. That secures the airway and makes sure and decreases the risk for aspiration. Again, the size of that's going to depend on the size of your patient. Pediatrics will not have cuff or those balloons at the bottom of them. Next, you're going to have a nasal trumpet. These are nasopharyngeal airways. They go through the nose, down the back of the throat, and help secure an airway for patients that are having difficulty breathing or unresponsive. And you can look at that in your first aid. They'll show you how to insert that. And next you have a oral airway. Oral airways should be used. They can be used as bite blocks temporarily in emergency situations, as well as maintaining open airway for using the bag valve mask.